Hello, everyone, and welcome to this recording on acceptance and commitment therapy. My name is Diane Bigler, and I will be your trainer. This is a two-part recording. Each recording will be 1 hour in length, and you are welcome to view both of the recordings back to back. You're welcome to view one recording and then come back and view the second recording. So this first recording will be an hour, and then this recording will end, and then you will be able to continue with the second recording. Thank you all so much for joining us. I'm going to go ahead and share my screen now so that we can get started with the presentation. You should also have the handouts that were sent out made available as well for this presentation. Please have those handy as we are chatting here. I invite you to follow along with me in the presentation here as we begin our discussion on acceptance and commitment therapy. Today, we're going to be focusing on an overview of ACT. We're going to be looking at some of the main philosophies of it. We're also going to be looking at the different ways in which ACT approaches problems and mental health challenges compared to some other theoretical models. You'll also find that it has some commonalities with some other theoretical models as well. So what does ACT stand for? You can see here that you have the acronym for what it stands for. The A stands for accepting your reactions and being present. C is choose a valued direction. And then T is take action. You're going to see each of these steps represented in the model of ACT and then also in our part 2, which is the interventions. You also see that I put some cheeky quotes here on our first slide, just to give you a little bit of a flavor of the way in which ACT approaches life from a philosophical or existential standpoint, right? So basically, as you can see from all of these different quotes, life is what it is, and whether that's wonderful things or horrible things, everything in between, ACT is really here to normalize that, to remind us that there is a certain ebb and flow in life, and to give us the strategies and the perspective to be able to manage all the things that life throws at us. Here's the direction of where we're going to be going to today in this training in part 1 and part 2. We're going to be looking at the basic knowledge base of ACT, the principles, and the key concept, which is psychological flexibility. We'll also be looking at interventions, and so that'll be more in our part 2. We're going to get into a little of those here in part 1. That'll be most of the focus in part 2 of this training. And then also throughout the 2 trainings, you will see a different rationale proposed for why ACT works with clients. You'll see this in case studies. Also, the evidence base really informs us that it is very efficacious and is very impactful and effective for people. I've been a licensed clinical social worker for 20 plus years. I've worked in a variety of clinical settings. I've also been a clinical supervisor, a professor of social work at KU for many years, and then my first love, which is training and education. And throughout all of it, I've had some advanced training on ACT and have been able to utilize it with different clients over the years in various capacities. So I'm really excited to talk with you about it today and share some of the different ways in which I have found and others have found ACT to be especially helpful. So what exactly is ACT? Let's really frame a discussion around what it is and kind of what some of the core tenets are. ACT is a mindfulness-based behavior therapy. So really interesting that you're going to see some parallels here with DBT. You're going to see parallels with CBT. You're also going to see parallels with solution-focused approaches and frameworks. ACT is its own modality, but it does build off of those modalities that I just mentioned. So we already see that just in our first definition, that it's a mindfulness-based behavior therapy. So we borrow the mindfulness from like DBT and some of those Eastern philosophies, and we also borrow the behavior component from both CBT and DBT. ACT assumes that the psychological processes of a normal human mind are often destructive and create psychological suffering. So basically what ACT says is the more that we ruminate, the more that we attach or fuse to our unhelpful or unpleasant thoughts, the more that we will experience suffering. The more that we're able to develop the skill of defusing or disconnecting from those unhelpful thoughts, the less suffering we will experience. Interestingly, symptom reduction is not a goal of ACT, right? You see some other modalities is like we have to reduce depression and reduce anxiety. But what we really find from the ACT perspective is that those attempts to get rid of symptoms can actually create or exacerbate clinical disorders. And so rather than having clients or us as professionals focus on symptom reduction, we really try to focus on approaching clients from different perspectives, which you're going to see here in this training. So there's some key elements of ACT that you see represented on this wheel on the right here. And we're going to start at the top at 12 o'clock where it says acceptance of private experiences. This is the ability for us each as individuals to accept the experiences we have in life, whether it's the slow person in front of us in traffic or waiting for some news on our health test results, a child that is struggling with their behavior or struggling in school, taking care of a family member, all of these different private experiences that we accept whatever those experiences are as they are happening. The other thing that you'll see in ACT, if you go to the right here at about 2 o'clock, is we see emotional distancing. So this means that it's not that we become emotionless, but what it means is that we actually begin to create a little distance between our emotions and ourselves. We do not become our emotions. Our emotions are a part of us, but we do not become the entirety of what that emotion is. The next component that you see here at about 4 o'clock is directing attention to the present. So really looking at the way in which, again, we're looking at that, aspect of mindfulness being central to ACT. At 6 o'clock in the green, we have perspective taking sense of self. So this is really being able, and this is kind of borrowing from CBT, where we really emphasize a lot of perspective taking of encouraging clients to take a helicopter view. So to kind of hover above their emotions or their thoughts or their circumstances and be able to see kind of the bigger picture. Now we maybe would call that like the drone view, right? Because drones are kind of what we see now, hovering above and kind of viewing what is down below. Over here at about 8 o'clock, we have identification of personal values. And you're going to see this is a big theme as well in ACT. And this is a big driving force towards developing goals and taking action on those goals. And then finally, a commitment to achieve goals in line with personal values. That's where you see the value. We call this values congruence, and this is when our behaviors and our choices are in line with our values. What we find is that human beings generally experience less suffering and less difficulty in life if their choices and behaviors align with their values. So that's a lot of what we're going to be talking about here in our 2 hours together talking about ACT. Okay, so what is the goal of ACT? The main overarching goal of ACT is to create a rich, meaningful life while accepting the pain that inevitably goes with it. So that's really kind of it in a nutshell in terms of what ACT is. It's this duality, and again, we're borrowing from dialectical behavior therapy, which is the dialectics of two opposing things can be true at the same time. So we can create a rich, meaningful life while also accepting the pain that goes with it. It's kind of this yin and this yang, so to speak. So in ACT, we really help clients focus on, for example, what is important, what's important to that person. So what's important is more of that overarching kind of maybe life importance. What's important to me are like my specific values, goals, experiences. How can I move towards those goals? How would you choose to make your life unfold? And what direction would you choose? So with that being said, what I'd like to do now is just do a quick video introduction to give you an opportunity to see what ACT looks like in person. Before we do that, I just want to make one quick change here in my PowerPoint. And then we will be ready to show the video. Okay. So this is just a video introduction. This is Susan. And you'll get a sense here of kind of Susan's background and then also an introduction to ACT.
A single mom who works 2 jobs to support her son, Josh, in college. She grew up in a military family and followed in her father's footsteps to serve her country. Aside from being a proud mom and vet, Susan enjoys gardening and volunteering at the USO, bringing out the best in others. But recently, she's been feeling down and keeps to herself. Her friends have noticed she hasn't called. At first, Susan thought it was just empty nest syndrome after Josh left for college. But it's more than that. Most days, she thinks a lot about her past, wishing things turned out differently, and she regrets some decisions she made after her husband died. She worries what the future will hold. Susan tries to push away these negative thoughts, but can't. She feels stuck in a black hole. Josh noticed this while he was home on semester break. It reminded him of when his high school girlfriend had depression. So, Josh told his mom he was concerned. Susan dismissed it at first. But then Josh's words got to her. She realized she needed to do something to get unstuck and move forward, but she didn't know what to do. So, Josh, a computer science major, went to Dr. Google. At first, he found way too much information about treatments and resources. What could he trust? Then he came across a public education website created by experts called Treatment Works for Vets. He showed it to his mom. She was skeptical, but she liked that it focused on vets and proven treatments. One treatment stood out: acceptance and commitment therapy, or ACT. She liked that it helps people get unstuck from difficult thoughts and feelings and move forward in their lives. ACT is a talk therapy that teaches proven skills for accepting and not being controlled by negative thoughts and feelings that lead to depression. By freeing oneself of the weight of their thoughts and feelings, ACT allows people with depression to take control over their lives. ACT also helps people move forward by helping them figure out and work toward what truly matters to them, what they want their lives to be about. Studies show ACT is effective in helping both veterans and non-veterans overcome depression and lead more fulfilling lives. And it usually requires only 12 to 16 sessions. Susan wasn't much for therapy, but ACT sounded different. The idea of learning how to stop struggling with her thoughts and feelings and how to live the rest of her life in a way that really matters to her made real sense. So, she told Josh she'd give it a try. Learn more about ACT for depression and see Susan
Okay, we're going to come back to Susan here in just a few minutes, but that gives you a little bit of an idea of kind of the appeal of ACT, especially around depression. You heard in the video that Susan is a veteran, and so she's really struggling with being stuck. And so this video just gives a little bit of a sense of what she's experiencing. So let me make sure I'm properly sharing the screen here. I've got to make sure I'm clicking all the buttons correctly, and I think we are all set to return to the presentation. So you could hear in the video that a lot of the questions you see on the screen here were actually addressed, right, in terms of the areas that ACT focuses on and really helping to realign Susan with what is important in her life. So I mentioned earlier that ACT is different than CBT, and I am an eclectic therapist. I'm sure that a lot of you are as well, meaning that you do not practice or, ascribe to a particular philosophy or model that, we as professionals, I think a lot of us are probably social workers, counselors, et cetera, that we believe in the value of diverse interventions and offering clients diverse ways of helping them, right? We would want the same thing if we went to a doctor, right? We would not want to be treated like every other patient. So I love the value that utilizing different models brings to us as practitioners. That being said, I do think that, we do have to distinguish between what are some of the differences. Even though ACT has borrowed some things from CBT, there are some distinct differences. So for example, CBT's focus, this is the main difference that we see between CBT and ACT. CBT's focus is reducing or eliminating unhelpful thoughts, feelings, and bodily sensations. And we do that through things such as cognitive restructuring. That's the main component of cognitive behavioral therapy, is really helping clients unpack, identify, evaluate, and modify these unhelpful thoughts. There's a lot of focus spent in CBT on that process. In ACT, we really see that the approach is more of reducing the unwillingness to experience and efforts to control thoughts, feelings, and sensations. So whereas CBT says we actually need to write down our unhelpful thoughts, evaluate them, see if they're accurate, and then create new, more helpful thoughts, ACT says we don't really need to go through all of that, right? We just need to acknowledge that this unhelpful thought is there, and then we do some other things instead of really wrestling with that thought and trying to change it. So here's a quick example to better differentiate. Let's say that somebody's automatic thought, such as Susan's in the video, is I can't handle this. The CBT approach would be the cognitive restructuring, right? So the therapist would really help the client, and this could take several sessions, to identify a new, more helpful thought, such as I've handled tough situations like this before, or I can tolerate distress and uncertainty and be successful. And in CBT, we would go through a process of really helping the client reorient themselves to this new thought and have them evaluate how much that is successful in mitigating some of their depression or anxiety. What ACT says, and the approach of ACT is this: I am having a thought that I can't handle this. And we call this cognitive diffusion. And this is getting distance from the thought while also accepting it. So I'd like you to imagine that you are a mountain, right? And so you are a mountain. As you know, mountains don't move, they're stationary. But what does move above a mountain are clouds, right? So if you look at like a video of a mountain, you'll see the mountain is still, but you can see that, the clouds are floating on by above. So if you can imagine yourself as a mountain and you can imagine your thoughts as those clouds, the mountain would just recognize, oh, there are clouds that are floating above me. They are over here. Now they're in front of me really strong. Now they're floated on by and they're not as strong as they were when they were in front of me. That is a metaphor. We're going to talk about metaphors later. huge in ACT, but that is one of the metaphors that is used to try to help and explain how in ACT we really develop a different relationship with our thoughts than we do in CBT, right? So this kind of is just an important note to differentiate CBT from ACT. I love CBT. I taught the course at the University of Kansas for many years, actually developed the course there, and have been trained, formally trained in CBT at the Beck Institute. And I love CBT, but it does have limitations. It's not appropriate for every client, and there may be some clients that it actually makes them worse to engage in that thought restructuring than to look at maybe an ACT approach. Okay, so let's continue now to talk about the 6 core concepts of ACT. These are the 6 core concepts that you're going to see represented. You're going to see them in a hexagon. It's called the hexagon in ACT, and these are the ways in which we find direction in what ACT is and how to help clients. So I'm just briefly going to talk about each of these. The first one is acceptance, and this is really making contact with all of your internal experiences without trying to escape, change, or control the events, right? So if you're experiencing something unpleasant, you don't run away, that fight, flight, or freeze. You are in full presence of what is happening, even if it is a moment of suffering. But acceptance really means opening up. Means making room for painful feelings, sensations, urges, and emotions. We drop the struggle. So instead of fighting against what is reality, we accept what that reality is. The next one is cognitive diffusion, which I alluded to on the previous slide with the mountains and the clouds. Cognitive diffusion is defined as stepping back from our thoughts and observing their presence. It just means that you're no longer driven by the content. So this is just, again, that drone or that helicopter view, that you're not on the ground, like boots on the ground with your thoughts. You are actually creating some distance to try to get some perspective. So instead of getting caught up in our thoughts or being pushed around by them, we let them come and go as if they were just cars driving outside of our house, another metaphor. The next concept is number 3, which is present moment awareness. This is the process of being non-judgmental. This is the core of mindfulness. This is present focused awareness that if we are in a situation, if we're with someone doing something, we are really focusing in on this moment, all of our experience in this moment. Number 4 is self as context. Self as context. This is really being able to observe and experience our inner and outer world, and also be able to distinguish those from our thoughts, feelings, sensations, and roles. So it's really just looking at ourself as separate from everything else that is happening in life. Values, number 5, values are paths or directions defined by the individual as important and meaningful. We all have different values, right? We may share some similar values with other people, but probably no 2 people have exactly the same values to exactly the same degree. So there's individuality and diversity that we as clinicians really need to recognize within our clients. Some of our clients have never heard the word values or have never had a professional or anybody ask them about their values. So this may be really new to them. And so you will really need to do some work in helping them feel comfortable in exploring what their values are. And then finally, we have committed action. This is the ability to take committed action, walking the walk, right? Not just saying you'll try something, but actually doing it. Committing yourself to feeling better, getting better, thinking better, experiencing life better, etc. Committed to behavior change and realizing that's a key component of feeling better and improving your life. So with that being said, I'd like to read you a little metaphor, which is the boat metaphor. You actually have this handout. This is your first handout in your packet. Looks like this. I don't know if you can see that with my screen that has the boat on it. But this is the first handout in your packet. And I'd like you to just kind of take in this image on your handout as I'm reading you the boat metaphor. An easy way to explain therapy to a client is by comparing a human being to a sailboat. Most people come to visit a therapist because of a problem. For instance, a client may find it difficult to cope with negative emotions, such as fear. The problem can be compared to a leak in the boat, right? So you can see on your handout here where the leak is, right? This is the personal problem or the limitation that prevents values-based living. It's important to fix the leak or else the boat will sink. However, even if you stop the leak 100%, your client will still not be able to get anywhere. It's their sails, which is their strengths in this case, that actually give your client forward momentum. You need to take care of your leak to prevent yourself from sinking, but you need to hoist your sails to catch a favorable wind and move forward. The main question is, what does your client want to move to? Which direction does your client want to take? Direction of the boat is determined by the governor or the steering wheel. The direction we want to take in life is determined by our values. Values are the answer to this question. What do we find important in life? In other words, the governor reflects the values of your client. Once the boat of your client is moving forward, which is behavior change, your client may notice that there are people standing on the water side who have different opinions and reactions. The water side reflects the social environment of your client. The social environment reacts in different ways as a result of the change in your client. Some people welcome the change in behavior, whereas others find it difficult to deal with the new behavior of your client. It's important for your client to stay true to their own values and not let other people determine the course of their boat. No boat moves in isolation from the water. The water can be compared to the circumstances in life. Sometimes the water is calm and steering the boat is pretty easy. In other words, sometimes life is easy. We do not encounter a lot of difficult situations and stay on track. Sometimes, however, the water can become very turbulent, making it more difficult to guide the boat in the desired direction. Especially when the going gets tough, it's important for your client to be reminded of their values and use right techniques to cope with difficult water. When the boat of your client is moving, it is necessary to be aware of progress. Look out for the lighthouse. It is there to inform your client about their route. During this process of change, your client will experience positive emotions like joy, gratitude, energy. These emotions signal personal well-being and inform your client, just like the lighthouse, that they are on the right track. Okay, so you're really picking up, I think, by now on the theme of metaphors and ACT, that it's a really big component, and I really love the boat metaphor. I've used it many, many years to explain to clients really the foundations of ACT here. And so this is really going to inform a lot of the rest of our discussion as we look at all of these 6 different core concepts of ACT as we continue our discussion. Okay, going to our next slide. Who is ACT suitable for? I want to talk just for a minute about populations. The great news that you can see on the screen here, just like CBT and some of our other approaches, ACT is showing to be evidence-based with a variety of populations. You can see here anxiety, depression, OCD, chronic pain, substance use, schizophrenia, even borderline, workplace stress, eating disorders. Lots of varied application with different populations. So that's why we're seeing it as becoming more and more of an interest to people so that they can expand their toolbox beyond our kind of traditional 3rd wave or 2nd wave therapies, which is like behavior therapy, CBT. Our 3rd wave therapies, which are DBT, ACT, somatic therapies. These are the ones that I think practitioners are really wanting to become immersed in so that they have more options to be able to help their clients. Okay, what is the evidence for ACT? I don't want to get too far down into the weeds here. You can certainly just Google evidence-based for ACT, and there'll be a lot of different studies that you can review. I just wanted to mention that we do have empirically supported data that shows the efficacy of ACT with different populations and randomized and controlled trials. So, for example, across 20 meta-analysis, 133 studies, and over 12,000 participants, ACT is efficacious. It shows positive effects for a broad range of target conditions that we just saw on the previous slide. Some individuals, I encourage you to get familiar with her Patty Bach. She has been able to utilize ACT for the treatment of schizophrenia in 4 sessions, right? Which is unbelievable because we've never really had the option to offer clients with schizophrenia such ability to make progress within such few amount of sessions. Joanne Dahl has done a lot of work around chronic pain using ACT in 8 sessions. So any of you that work in hospital settings or in hospice, palliative care may find her work really interesting. And then also Kirk Strassel. For those of you also that work in hospitals, community mental health centers, ultra brief therapy, which is 1 to 2 30-minute sessions. So if you're literally just going to have a few meetings with a client, Strassel has really utilized ACT as a way to be able to help clients in a very short amount of time. Okay, so what I would like to do now is show you our next video on Susan. If you remember Susan that we saw in the first clip, now we're going to watch the continuation of Susan's story.
Susan has fought her whole life for what she has. Working multiple jobs to support her family, serving her country, and raising her son alone after her husband died. But Susan couldn't beat her battle with depression. With the help of her son Josh, she learned about a proven talk therapy called Acceptance and Commitment Therapy, or ACT for depression. That's helped many people, including vets, get unstuck and move forward in their lives. Susan decided to give it a try. Working with her therapist, David, Susan learned she had a number of negative thoughts about herself and the future that she tried to push away, but they kept coming back. To stop this tug of war, Susan learned how to relate to her thoughts differently, which involves stepping back and observing thoughts rather than taking them as facts. Observing herself having thoughts, as opposed to being the thoughts, lifted a big weight. Next, Susan discovered how to live more in the present, instead of focusing on how things might have been, using a skill called mindfulness. Mindfulness involves observing what's going on inside and outside of us, without judging what's happening. Like noticing the feeling of cool raindrops on your skin, the taste of an orange, or the smell of fresh baked bread. With some practice, Susan saw this helped her get out of her head and connected to her life and the world around her. Throughout the treatment, Susan focused on how she chooses to live her life. First, she worked with David to clarify her values. What really matters to her? Then she focused on bringing those values to life. Before ACT, Susan didn't think much about how she wants to live her life. She just went day to day. To help her figure out what's important to her, David asked Susan to imagine herself at her 90th birthday party. Who's there, and what would she want them to say about her? Focusing on what's important reconnected Susan with parts of her she'd lost touch with. She identified values in 3 areas: being caring and compassionate, becoming closer to others, and challenging herself to grow and improve. Taking steps to bring these to life helped bring Susan to life. After just over 3 months of treatment, Susan's depression lifted. She feels more in control of her life and like she's moving forward. Not only has she started a volunteer training program at the USO, she's begun guitar lessons and enrolled in a local gardening club. When Josh returned from college, he saw and felt the difference in Mom right away. If you're feeling stuck like Susan and want to move forward in your life, there is effective help available. Learn more about proven treatments and how to get started on a new path at Treatment Work.
Okay, so that gives you a further glimpse into Susan's treatment and her process with ACT. Just gives you a little bit of a snippet on what was successful for her, some of the different ways in which you saw the work that was done with values, right? Speaking of values here, our next slide. Would like you to just engage in a reflection exercise, or maybe do this with your clients or a family member. So from this core values list here, you could identify your top 5. So whatever top 5 values jump out to you, maybe right now just identify maybe your top 2. And you would write those down in big letters. So maybe one of your values is friendship. Maybe one of your values is spirituality. Maybe one of your values is peace. Then I would like you to identify some recent behaviors or actions that align with either of these 2 values that you identified. So what are some actual behaviors, recent behaviors or actions that you can say directly are in line with one of your 2 identified values? So if one of your values is friendship, maybe you made some time and went to a friend's house the other night for dinner and to hang out and laugh and watch some TV together, right? That would be an example of an action that relates to your value of friendship. So after you write these down and draw the arrows, you would pause, and this is the mindfulness part, right? This is really just the focusing. What does it mean to you to look at your list? How do you feel? How does it feel to know that some of your actions, a lot of your actions probably are connected to your values, right? And what sense of feeling does that give you? This is one of the great exercises to do with a client initially in ACT, right? And as you can see, this is what Susan was returning to, that helped really begin to alleviate some of her depression. So values are extremely important in ACT and are really kind of one of the foundations. So let's shift gears just for a few minutes and talk about case conceptualization in ACT. So, part of our role is to gather some brief history and information from a client. The conceptualization is really not only the data we gather, but how we make sense of the data as professionals. So you can see here in all of these different bars on the screen, all of this information that we would like to be able to gather from clients over a few sessions. This doesn't all have to be like at the first meeting, but you can write these on pieces of paper and have the client pick one. You can write these on the Jenga, the little wooden Jenga game on those little pegs, and then play Jenga if you're working with like teenagers, etc. There's a lot of different ways to use these questions, but this is very important information to gather from the ACT perspective, because this information is going to guide how we help the client with those 6 core components of ACT that we talked about earlier. So we want to get a sense of the client's story, what they've tried, why the client is, or why the problem is actually a problem. What would they stop, or do more or less of if the problem was solved? That's kind of like a solution-focused miracle question, right? So we see kind of, elements of solution focus there. What direction would they like to take their life in? Remember the sailboat. And when do they ever feel like a sense of purpose or meaning doing what? Think back to Susan, and a lot of her purpose and meaning was in her family and then also in her community, right? So you saw at the end, she reconnected with her veterans program. She was gardening, really just like connecting with those parts of her life. So in your packet, you have a few handouts that I'm not going to go into a lot of detail. They're more just for your kind of take-home resources. The first one is just a basic guide to ACT case conceptualization. So it is a resource for you to take a look at. It gives you a lot of good information on questions that you should be thinking of when you're meeting with clients, or maybe you should try to get a sense of from a client if you're wanting to go into this ACT direction. The next handout for your resources to put it into a personal sense is Brian's case conceptualization. And this is just a way for us to understand what all of these questions on the screen actually look like once we've met with the client. So Brian is client, you'll see kind of how all of these pieces on the screen come into play in his particular case here. So I encourage you to take a look at that at your leisure. But the case conceptualization is going to be the foundation of how we're going to proceed, how we make sense of what the client is bringing to us, and then how we're going to best be able to help that client. Okay, our next slide here is introducing the concept of psychological flexibility. And I just want to note before we tackle this that we will return to conceptualization in part 2. I'm just kind of introducing it a little bit now. Feel free, I think what would be really helpful, especially if you're going to break up these trainings, watch one, take a break, and then watch the other, is read the handouts that I just pointed out, the case conceptualization and the Brian's, and that'll really give you a sense before you view part 2 of how we do case conceptualization in ACT. So psychological flexibility, as you can see, typically here is represented by this triangular, visual where we look at these 3 interlocking components. The first one is at the top is be present. And so again, the M word is coming into play here. Having contact with the present moment, the mindfulness, the self as context, right? So an example of that would be, let's say that I'm sitting with a family member that gets on my nerves, and which, that's life, right? People get on our nerves, and I'm feeling irritable. So rather than saying, oh, I'm so irritable right now, I could say, I'm feeling irritable in the moment. I'm still want to focus on being here, contacting with, with the present moment, rather than connecting so much with my emotions. So it's just being able to kind of make that separation. Also, we see opening up on the lower left-hand corner, right? So this is the ability, as we talked earlier about acceptance, opening up to the fact that life is going to, sometimes the waters are going to be smooth, other times the waters are going to be choppy, right? Diffusion, we're going to get more into this, but that's, again, not magnetizing ourselves to our thoughts, right? It's being able to create some distance. When we create the distance, we can view things from a little bit more of a rational perspective. And then this allows us to have some of the freedom from feeling so upset, right? Or feeling like our thoughts are totally true. We have to totally be in our thoughts, when in reality we don't. We can self-direct somewhere else. We can make another choice. We can distract. There's so many things we can do to diffuse away. And then bottom right, we have doing what matters. So this is taking committed action to live your values through doing what matters. Taking committed action to live your values by doing what matters. We see this philosophy a lot in substance abuse work, right? If you look at the 12-step program, or just any kind of general substance abuse approach, is usually helping clients that are beginning recovery identify what is important to them, what they've lost track of, what was important to them prior to their addiction, and helping them reconnect to those values. Then we really help them figure out ways to take committed action towards those values, right? Maybe they have new values that they didn't have prior to their addiction. But this is something we really see a lot in substance use. That's why ACT works so beautifully in the realm of substance use, especially. we find. So psychological flexibility, remember, is just, think of like a palm tree. I'm going to use another analogy. I'm just, because I'm ACT trained. Once you become trained in ACT, you kind of like see all these opportunities for analogy. So think of a palm tree. The palm tree is one of the strongest trees. And so think of that palm tree that has a very, very firm base, right? What does that palm tree do though? It sways, right? The palm tree can bend and almost bend to the ground, but rarely does it break. It maintains the strength at its base, but yet it's flexible, right? If the wind blows it, it's like, hey, I'll go to the left. Oh, you want to go to the right? We'll go to the right. Okay. And so think of yourself as kind of like a palm tree, or as Bruce Lee said, remember the martial artist Bruce Lee, be like water, right? Just take the shape of whatever is around you, right? If it doesn't go your way, oh well. If it does go your way, great, right? It's almost the stoic approach. If you study stoicism, a lot of connections between stoicism and what we're talking about today in ACT, cognitive behavioral therapy, and DBT. Study and research stoicism. Very interesting. So psychological flexibility, this is a really a huge component of ACT, and you have two handouts that are for your reference, for your own use as a person or professional, and then for you to also use with clients. The first one is the ACT Advisor. This is, assessing one's psychological flexibility. So there's arrows here of 1 to 10, and it's kind of like a Likert scale. For example, do you spend most of your attention paying attention most of your time, paying attention to what's happening in the present moment, or do you spend most of your time lost in thoughts about the past or future? So 1 to 10, and then so you work through this hexagon here of all these different ACT areas. I love this handout. It's one of my favorite ACT ones because it's a great assessment tool for you to utilize with clients. And I think also for you to utilize on yourself as well, right? We should always be willing to use the tools ourselves that we ask our clients to use. I really very much believe in congruence, and that therapists should be authentic by utilizing the tools that we so much want our clients to utilize, right? Okay, and then the next handout is assessing psychological inflexibility. So these are, again, just questions for you to ask, think of asking your clients, or think of maybe conceptualizing it as you're working with a client to see what their level of inflexibility is. So either one of these handouts is going to be great resources for you to be able to assess your client's level of psychological flexibility. But this is a huge component of ACT, psychological flexibility. Okay, the choice point is another key thing that I would like you to remember in ACT if you want to write this down. The choice point, as you can see in the diagram here, we're really going to look at two different areas. The first area we're going to look at is the one on the left. This is things that take you away from your values. These are hooks, if you can imagine like a fishing hook. Things that hook you and actually yank you away from your values and purpose and freedom and joy in life. These are the urges to avoid discomfort. So if you're feeling like, oh, I'm going to be really socially awkward at that party, I don't know a lot of people, so I'm not going to go and I'm going to totally avoid everyone. Probably not the best choice, especially if you struggle with isolation. It's probably a good idea for you to get out and be with other people, right? But if you have this urge to avoid discomfort, that is a hook. Desire for short-term gain. So if you avoid going to the party, you immediately feel better. You're like, whoo, dodge that bullet. But then typically you feel 10 times worse because you feel guilty. People are blowing your phone up. Where were you? And you have to make up some lame excuse. And it's just this huge, usually very like self-shaming cycle, right? Old habits. So you, again, think of substance use, old habits, old neighborhoods, old patterns, old friends. A lot of times in addiction, you really have to cut a lot of that out of your life, right? And really design kind of this new life. Hooked by thoughts, we talked about that earlier. Stuck in a story, so like a tape loop, a story from your past. So all these different examples of hooks. That's one example of a choice point. We have a choice to live in that world, or we can move the meter towards the right and move towards our values. Instead of hooks, we can have helpers. Helpers are things such as awareness of our values, skills such as present moment awareness, diffusion, acceptance, that flexible perspective taking, goal setting, etc. Doesn't that sound so much more lovely than stuck in the story, urge to avoid discomfort, old habits, etc.? So our work as clinicians is to help clients move from left of center to right of center. And clients are going to be at different places along this continuum, right? Really interesting point here that experiential avoidance increases suffering. So the more that our clients avoid life, avoid people, avoid feelings, avoid doing, the more it actually increases their suffering. And we need to educate them on that. We need to educate them on that loop. It actually does not relieve their suffering to avoid and escape and not live their life. That actually increases their suffering. And that's like a whoa moment for a lot of clients, right? Resource for you, if you go to YouTube, here's the link, which will make this PowerPoint available to you. The Choice Point, great 3-minute video on YouTube for you and for your clients if you want to show your clients about ACT and the meter that we just talked about on that previous slide. Okay, so what is mindfulness? Mindfulness, I love mindfulness. I'm sure, oops, did not mean to do that. Computer went a little haywire there, right? So I love mindfulness. It means paying attention with flexibility, openness, and curiosity. This allows us to maybe either broaden our focus or focus our focus, right? Maybe we need to be paying attention to the bigger picture, or maybe we need to be paying attention to a very small picture, a person, a situation, an experience, etc. So with that being said, I want to share with you another tool, and I'm sharing with you a lot of tools because we only have a couple of hours together. So, rather than being able to go into a lot of detail, I'm kind of hitting the main points, and then I'm giving you some of these resources to take and run with. So one of those I want you to take and run with is the 5 Facets Mindfulness Questionnaire. Before you give this to a client, I would ask that you complete it yourself, because again, there's that level of congruence. How can we teach and coach our clients in mindfulness if we don't have any flippant idea of our own level of mindfulness, our strengths, our challenges? So take about 10 minutes, complete this, and it'll really be eye-opening in terms of all of these components of ACT coming together in this particular questionnaire here. Okay, so we have a little bit under 10 minutes left. We've covered a lot almost in this first hour, right? We've kind of laid the foundation for ACT. We've begun talking about some of these key points, such as psychological flexibility, diffusing from your thoughts, right? Not being so magnetized to them. We're going to talk a little bit about cognitive diffusion here as we wrap up our first hour. And this is one of my favorite conversations because this is such a powerful part of ACT, is looking at fusion versus diffusion. So I think one of the best contributions of ACT has been this concept of fusion versus diffusion. With fusion, think of a thought. It can seem like the absolute truth, a command that we have to follow, a threat that we need to get rid of as soon as possible, something that's happening right now, even though it's about the past or the future, something very important that requires all of your attention, and something that won't let go even if it worsens your life, right? That is what the experience is like for people that are fused to their thoughts. What about diffusion, right? Let's look at the gift of ACT and what it has presented in terms of diffusion. It's this recognition that a thought may or may not be true. Definitely not a command that we have to follow, not a threat. It's not something happening in the physical world. It's merely words or pictures inside your head, right? May or may not be important and can be allowed to come and go. So remember the mountain, you're the mountain, the clouds come and go. They pass by, or the cars on the highway, they pass by. They don't stay in one position right in front of you. So fusion and diffusion, this brings you to your handouts, which give you a lot of different examples of cognitive diffusion. That again is more of a resource for you to look through. I really encourage you to save your handout packet because it's got a really great library of things that you can use immediately with your clients. So these next handouts on diffusion are going to give you some really good specific interventions. And you have one specifically on cognitive diffusion and mindfulness exercises. So really combining those two core aspects of ACT to try to help clients with some of their thought patterns. So if you've tried CBT with clients and it really is not being successful, you may want to shift gears and try ACT, because as you can see, we're approaching thoughts and cognitions from a different perspective here. So this diffusion example, I think I'm going to carry over into our second hour of training. So we'll come back to that just to kind of look at a more specific example of diffusion with a certain population. So I wanted to share ACT with Joe Oliver, who's an ACT therapist. And this is just kind of an overview of some of the things that he did with a client in an ACT session. This will just give you a sense of what things look like in terms of beginning to work with a client. So his goal with this client was to set the stage to hopefully increase psychological flexibility. So that's really the focus here, is psychological flexibility. He opened the discussion by asking the client about values. So who or what is important here? So rather than my problem is blank, Joe wanted the client to be able to say, you know, what is important to me in my life? Kind of like what Susan did, right? I am depressed. This is my life, but what is important to me in my life? So remember we talked about those hooks just a minute ago and being on the left of that meter. The other thing that Joe did with his client was ask the client to describe some of these hooks, right? Invited the client to mindfully notice any of these feelings showing up during session. How many times do you all do that? Ask a client to think of, you know, any feelings that are coming up for you right now in this moment. A couple more things that Joe did was ask the client how he typically responds when hooked by these experiences. So was it experiential avoidance? What are the ways in which the client was kind of avoiding their life, right? And then ask the client to consider what a values-based action could be when those thoughts or feelings arrive. So instead of you doing blank, what would be something else that you could do that aligns more with your values, right? And that is that choice point that we talked about. So what I'm going to do here in our last few minutes is leave you with a case study of Neil that we are going to open up part 2 of this presentation with as we get into part 2 of this ACT presentation. Neil is a 21-year-old gay Indian American college student who presented with symptoms consistent with major depressive disorder. His struggle with these symptoms began in early adolescence when he first realized he was gay. He developed a negative attitude toward his sexual orientation because he felt different from his peers and struggled to fit in. Although he didn't experience overt victimization, Neil's social interactions were limited, and he was afraid people would reject him if they found out he was gay. He didn't disclose his sexual orientation at the time, but sought help for depression and received CBT. He learned skills to manage the symptoms, but continued to struggle with accepting his sexuality. Neil decided to seek treatment again at the age of 21 because his symptoms had become increasingly difficult to manage after he finally disclosed his sexual orientation to his parents. His parents weren't supportive, as being gay conflicted with their traditional and religious values. They encouraged him to pray for absolution and commit to academic and professional pursuits until he met a woman with whom he could settle down. Their frequent attempts to change his sexual orientation caused him a great deal of distress and exacerbated the shame he already struggled with. He responded by avoiding situations that might raise questions about his sexual orientation and engaging in substance use to avoid his pain. So this is our profile of Neil that I would like you to keep in mind as we are going to be entering into part 2 of this training on ACT. We'll return to Neil's case when we come to part 2, I've included some resources here for your learning that you're welcome to check out. These are also copied as well at the end of the second part of this ACT training. So with that being said, that concludes the first part of our 2-part training on acceptance and commitment therapy. This was hour 1. This recording will now end, and you are welcome to continue to part 2 of this training, or you're welcome to come back at a future point and continue with part 2 of the training. Thank you so much, and I will see you in part 2. Bye-bye.